Hello, my name is Enos and welcome back to my channel. This is Work and Wonder. If this is your first time, this is a channel where we talk a lot about the mental health nursing OSCE. So if this is your first time, please make sure you subscribe to the channel and turn on the notification bell. And anytime I upload a video, you'll be notified and you'll come straight here and take a look at the video. I know I've been off the channel for a while now. I've not posted a video for almost a month now, but then I'm back. I have a lot of videos that I'll be posting over the next couple of weeks, and this is one of them. Basically what I have done is that I have gone through all the comments that you have been putting under the comment section, and I've looked at the requests that you people are making, and one of them is about me making a video on the codings in the implementation station. So today this is what we'll be looking at. All right, so as I said, we'll be speaking about the codings that are used in the implementation stations. When we talk about codes, these are basically numbers that are assigned to reasons why you cannot give a specific medication that is due your time, usually regular medications. We know that on the chart we normally have the once only medication, the antibiotics, the regular medication, and then the PRNs. So usually with the regular medications, if there is a specific reason for which you cannot give a medication even though it is due your time, then you would have to use a code, and this code stands from code 1 to code 10. So we'll have a look at the code, and then we'll be looking at some very specific ones that are very much related in the mental health nursing OSCE. There are some of them you never use them, so I'll just speak about the ones that we would normally use when we are to code. Now let's look at the various codes that we have from code number 1 to code number 10. As you can see on your screen, we have code number 1, which says that medicine unavailable, inform the doctor or the pharmacist. Then we have code number 6, which is patient is off the ward. We have code number 3, which is self-administration. We have code number 4, which is unable to administer, inform the doctor, into bracket alternative route required. And then we have code number 5, which states that start dose given. Code number 6 is incorrect or unclear. Prescription is incorrect or unclear. Code number 7 is patient refused. Code number 8 is nil per mouth or nil by mouth. And then code number 9 is low pressure or low pulse. And then code number 10 is any other reason. So these are the codes that we have from code number 1 to code number 10. Now there are some very specific ones that you may never use in this particular exam, so I wouldn't really focus much on that. I'll be looking into code number 1, code number 5, code number 6, and code number 10. These are the ones that you are most likely to use in the mental health situation. And when I take the code by code, we'll look at the situation in which you are going to use them. Before I even talk about that, one thing you should note is that we only code regular medications that are due our time, but for some reasons we are unable to give it. Antibiotics are also classified as regular medications. So basically regular medications are medications that is given over a certain period of time at certain times. So for example, they can prescribe, let's say, sertraline, which is an antidepressant, 2 times a day, and then it can be given for the next 28 days. So it is a regular medication that you would have to give for the next 28 days. Now we do not code PRNs. PRNs are medications which we give as required medication. So as and when the patient requires it, then you give it. So for example, they can prescribe paracetamol, and then it will be stated that in terms of pain, when the patient is experiencing pain, then you give it. Or they can prescribe something like diazepam or lorazepam, and then when the patient is agitated or when the patient is restless, that is where you should give it. These are PRNs, or they are as required medications. So as and when the patient needs it, then you give it to the patient, but we do not code PRN medications. So that is what you should know. We do not code PRN medications, and we only code regular medications that are due our time, but for 1 or 2 reasons or for certain reasons you cannot give it, then you would have to code it. So we are going to start with code number 1, which is medicine unavailable, inform doctor or pharmacist. This is one of the codes that you are likely to use in the situation where the medication is not in the cupboard at all. So for example, the patient has been prescribed, let's say, sertraline. You search through the cupboard and then the medication is not there. If it is not there, the medication is unavailable, and then you would have to code this medication, code number 1. Usually, how do you code? Just go to where you would have signed for that particular medication if you were under normal circumstances to give that medication, and then you just put the code. So if it is code number 1, you just put 1, then you put the date under it, and in some situation you put the time under it. And that is just how you code a medication. So medication unavailable, the medicine cannot be found in the cupboard. As a matter of fact, you cannot even find it anywhere. So you are going to code it as code number 1. But there are some very specific situations where you can also use code number 1. For example, the patient has been prescribed a certain dose, and per the dose that is available, you will never be able to get that particular dose. So let's say the patient has been prescribed, let's say, 250 milligrams of sertraline, but then the only medications that is available is 200 milligrams of that same sertraline. So you can see clearly here that there is no way you'll be able to get a 250 milligrams. If you pick 1 tablet, that is 250. If you pick 2, that is 400 milligrams. So in this situation, that particular dose that you are also looking for is unavailable. And in this situation, you would have to also code it as code number 1. So these are basically the 2 situations in which you are going to use the code number 1. Now, code number 2, patient is off the ward. You are never going to use this one because the patient is going to be there for you to administer the medication. Then code number 3, which is self-administration. Here you are not also going to get it, or you are never going to use it because you'll be the one to administer the medication to this particular patient. Code number 3, unable to administer, inform the doctor, alternative route required. Now in mental health, there are some specific medications that we cannot give as mental health nurses. For example, if it is an IV medication, mental health nurses do not give IV medication. So if, for example, the medication comes as an IV medication, you cannot give it. But then in exam situation, you are not likely to be given an IV medication. It is always either a tablet, a capsule, or something that the patient is going to take by mouth. So you are also likely not, or unlikely not to give, not to use the code number 4, which is medication unable to administer, alternative route required. Now code number 5, this is one of the codes that you are likely to use in the mental health nursing OSCE, which is start dose given. So usually it can come in 2 ways. It's either the start dose has already been given and now the medication also appears as a regular medication. Now you look at the start dose, you go to the regular medication, it's due your time. But if you look at the duration within which that particular medication was given, for example, it was given 2 hours ago, it was given 3 hours ago, there is no way you would have to repeat that particular medication, because usually the interval is for 4 to 6 hours that you have to repeat the medication. But in this case, you can see that it has already been given 1 hour or 2 hours ago, and then if you repeat it, that is more or less like an overdose. And in this situation, you would have to code it as code number 5, which shows that the start dose has already been given. This is the first situation. So the medication has already been given as a start dose. Then when you got to the regular medication, it also appeared there for you to give it. In this case, it has been given and it's not up to 4 to 6 hours, so you do not have to repeat it. Now, another instance too is that you can be given the medication as a start dose. It has not been given yet. You get to the regular medication and you realize that that same medication has been repeated. For example, you've been given sertraline. It is supposed to be given as a start dose. This has not been given yet. You go to the regular medication and it is also due at 12 o'clock, and that is per your scenario, you are given 12 o'clock medication. So it has appeared as a regular medication which is due your time, and then it has also appeared as a start dose which has not already been given. So you can see in these 2 instances, these 2 medications or this same medication is due at 2 times. In this case, you are going to administer it as a start dose, and then when you come to the regular side, you are going to code it as start dose already given. So that is another instance in which you'll be using the code number 5. The medication appears as a start dose, it has not been given yet. Then you come to the regular medication, it is also due the time that the scenario says you should give the medication. In this case, you give the start dose, and when you come to the regular medication, which it was also due your time, you are going to code it as code number 5. It's just basically as simple as that. Now, code number 6, which is the most popular one, which is prescription incorrect or unclear. Usually, this is the most popular one that we use. If the doctor's name is not there, if his bleep number is not there, if his signature is not there, if a certain part of the medication is not very clear. For example, the medication is coming as a tablet, and now when you go to the route of administration, they are stating that the route of administration is the eye. It means that the route of administration is not quite clear. So in this case, you are also going to use code number 6. If the doctor's bleep number signature is not there, you are using code number 6. So with this one, if it has got to do with the prescription, a certain instruction that needs to be there but it is not there, then you are going to use the code number 6, which is the most popular one. Now, the code number 7, patient refuse. The patient is never going to refuse. They are going to make sure that they take it for them to fail you. So here you are never going to use code number 7. Then nail by mouth, which is code number 8, you are not also going to use this one. Then code number 9, which is low pulse or low blood pressure. In most mental health cases, we do not use this one. But you should have to take into consideration when your patient has his or her own mental health issues, but they also have something like hypertension. In this case, if they have prescribed some sort of hypertensive medication and that medication would primarily lower the blood pressure of the patient, then you need to ask the assessor what is the blood pressure of the patient before you administer such a medication. But usually in an ideal situation, mental health patients don't normally, they are not going to give you these hypertensive unless the patient also has his own or has some sort of a hypertensive diagnosis attached to it. But in most cases, code number 9, you are not likely to use it. Now, the last one, which is code number 10, has got to do with any other situation. Here, usually, we use the code number 10 for situations where the patient is allergic to the medication. So, for example, the patient has been prescribed flucloxacillin, but in the history, it is stated that the patient is allergic to penicillin. In this case, it means that you cannot administer flucloxacillin because it is a derivative of penicillin. So here, you would have to code it as code number 10. This is usually what the code is. Usually, code number 10 is usually used for. So these are the codes, code 1 to code 10, and as usual, code number 1, code number 5, code number 6, and code number 10. These are the most popular ones that you'll be using in the mental health OSCE. One thing you should also know about the codes is that usually at the last part of the prescription or the medication administration sheet, there is a section where all the medications that you have coded, you have to rewrite them there. That is what is showing on your screen now. As you can see, you'd have to put the time, the date, the medication itself, the route of administration, and then the reason why you even coded that particular medication or you omitted that particular medication. You have to state that. And then, of course, you put your name or your signature at the very bottom. If you coded the medication on the actual prescription sheet and you do not recopy them back to this last page, you are still going to fail because it is a requirement of the OSCE that you have to recopy them back there. So this is just the overview of the codes. These are the codes that you need to know, and then in situations where you need to use them, that is what I have already explained to you. So if you hear code, you have to code it, that is what usually people are referring to, or that is what is being referred to. So basically, that has been the video for today. If you have any questions, don't hesitate to put your questions in the comment section, and I'll go through the comment section as I read them. If there is any response, I'll use my YouTube shorts to respond to that. Please make sure that you subscribe to the channel, and then of course turn on the notification bell, and anytime that I upload the video, you'll be notified, and then you'll come straight here and see whatever video I have uploaded. My name is Enos, and this is Work and Wonder.